They were in Vegas. Like it is. I don't know if I like my incredibly, lawyers been listening to being part of a huge family. They met. They played my not play poker with this business. But they went and got pizza with them. I was like, do you talk to me for that? I'm like, I'm and she's like, oh, yeah, what is it? What district is it? They're a big one. I have a history person. I know you brought. I was broke as usually, but not always. So.
Okay. Welcome everyone. I was waiting. We are recording tonight's presentation, but our camera guy is nowhere to be found. So we'll just get started. I don't want to hold us up. We're all here to hear our speaker. So, so my name is Carolyn Hoffman. I'm the director of the Sinai Temple Mental Health Center. I welcome everybody here for tonight's presentation. A little bit about the center before I introduce Dr. Rosmarin. Over the last 2 years, in partnership with Rabbi Nicole Guzik, is she here? Okay. I've worked hard to make the center a valuable mental health resource for the entire Sinai Temple membership, our clergy, and our staff. In addition to providing individual consultation to individuals and families each year, the center offers engaging community programming on relevant mental health topics. Tonight, I hope you will take this opportunity to not only learn from our speaker, but also to connect with each other in conversation. Through the center's establishment and growth, we strive to combat the unfortunate stigma still surrounding mental health that too often keeps those of us in need from accessing vital support and treatment. Attention to our emotional well-being is not only essential to leading a rich, full, and meaningful life, but is also a fundamental Jewish value. When we pray for refuat hanefesh, we recognize our desire for emotional and spiritual well-being. We are obligated as human beings and as Jews to address the importance of our mental health and to help each other when we struggle. I'd like to introduce our speaker. Dr. Yeah.
He's recording it. He's up in the booth. He's recording it right now.
Oh, perfect.
We're recording. We're not streaming.
We're recording, not streaming. Okay, thank you.
Doing it the whole time.
Oh, all right, perfect. Oh, all that exercise for nothing. Okay. Actually, it's always for something. Dr. David Rosmarin is the founder of the Center for Anxiety, with offices in New York, Boston, and Princeton. An associate professor at Harvard Medical School, and director of the Spirituality and Mental Health Program at McLean Hospital. He is a clinical innovator in the treatment of anxiety, a board-certified clinical psychologist, and peer-reviewed scholar whose work on the integration of spirituality and mental health has been featured in Scientific American, the Boston Globe, Wall Street Journal, and the New York Times. Dr. Rosmarin has helped thousands of patients and organizations learn how to live happier and more productive lives. For over 2 decades, he has taught people to overcome the stigmas associated with anxiety by embracing all of our human emotions, to learn from them and thrive. Tonight, we have the honor to hear Dr. Rosmarin share ideas from his newly released book, Thriving with Anxiety, 9 Tools to Make Your Anxiety Work for You, which emphasizes that anxiety is not a disease, but a natural human experience that can help us thrive in our lives if we have the right tools. So, welcome to all of you, and welcome to Dr. David Rosmarin.
Thank you so much. Really appreciate that introduction and the opportunity to speak with you here today. What an incredible community you have. I got to speak with the middle schoolers earlier today. That was one of the funnest talks I've ever given. 6th, 7th, and 8th grade. I was definitely anxious going into that one. Let me tell you. But they put up with me. Just met with some of your mental health professionals, and here we are, meeting as a community. This place is a beehive. There is so much going on in this building. It's a really amazing thing to see. So just thank you for opening up your doors, welcoming me to speak about how to thrive with anxiety. Now, as someone who has a reasonable amount of anxiety myself, when was this booked? When did we book this? It's like 6 months ago at least, right? So I'm like, okay, I'm coming out with a book in October. Let's book something in November, December. Let's try to figure this out. And then all of a sudden, the events of October 7th happened. And the release of my book was October 17th. And I was thinking to myself, thriving with anxiety? David, are you kidding? You're going to thrive now? I remember October 8th, October 9th. It was a daze. I was in a daze. It was a horrific, horrific week. The news coming in and the media and I mean, it took me several days to just recalibrate. And I had these book events on the calendar, happening, and many of them in the Jewish community. And what am I going to say? And is this relevant anymore? Maybe I should just, whatever, move on and write the next book, right? Struggling with anxiety. Let's get real. What's actually going on here? And then a couple days later, it actually sunk in, and I realized that the message that I have in this book, there has never been a greater time to think about how to transform our anxiety into something positive and to stop resisting against it. In many ways, this talk is more applicable than it ever has been, especially to the worldwide Jewish communities. And at the outset, I want to set the expectations. My work on this book in general and this talk that I'm going to give is not going to help you become less anxious. I'm very sorry. You will not have any tools. You will not learn any tips. You will not learn a single trick from me on how to reduce the anxiety that you might have in your life. If you were looking for something, I'm very sorry. You can have your money back. But the reason why I'm not going to recommend getting rid of your anxiety or ways to get rid of your anxiety is because I have a different recommendation. And I believe my recommendation is actually better than any anti-anxiety strategy or even medication that you might have. Nothing against medication, by the way, and we'll talk about that a little. And this approach is likely dissimilar to what you've heard before. You probably have not heard this before. And the central premise is very simple. It is time to change our relationship with anxiety. We view this as something that we must get rid of. We view it as a disease. We view it as something we have to stop having all the time. Instead, I believe we must accept that anxiety is and will be a part of our lives. And then comes the great question of now, what do we do with that anxiety? And once we accept it, I mean really and truly accept that we will feel unmoored, uncomfortable, anxious, have palpable sense of disquietude in our lives. There are amazing things that happen. There are great things that we can do with our anxiety. To give a bit of historical context of how I came to all this, over the past several years, we have been confronting unprecedented levels of emotional distress in the United States of America. 2 decades before the pandemic, there were warnings in the academic world, among clinicians, government bodies, everybody's saying that mental health is going through the roof, or mental distress is going through the roof, anxiety in particular. During the 2010s, there was a 50 to 70% increase in anxiety, especially among young adults and teens worldwide in the United States. Before 2020 came, in 2019, how many people in this country had an anxiety disorder? Any guesses? What percentage?
Wasn't it about 75 to 80?
No. The answer is 19.1. Now it's probably pretty close. But that was 50 million people per year. 50 million people per year with an actual certifiable anxiety disorder. And then COVID happened. And the rates went up 25% among young adults and 50% among kids. And by the way, this is not just because we're defining mental distress better, right? A lot of people think, oh, okay, anxiety is just happening because we're monitoring it more. No. The suicide rate is through the roof in this country. It is the second leading cause of death for individuals under the age of 34. The second reason why people die. And the top reason is accidents, which are often suicides, which people don't know. So it might even be the top reason, including ages 10 to 14. I didn't share this with your middle schoolers today. I also didn't share that anxiety and depression is the number one cause of disability in this country. The number one reason why people stop working and start going on government subsidies in order to afford their life. I also did not share that 1 in 20 preteens, 5% of preteens in this country are engaging in non-suicidal self-injury. They are harming themselves because of negative emotions. And 1 in 5 teenagers. These are objective behavioral measures that something is going off a cliff in this country. It is not just a matter of definition. Something is very, 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 very wrong. Healthy children today have the same levels of anxiety that hospitalized psychiatric inpatients had in the 1950s. They will report the same levels of anxiety as it used to be. And during the 1950s, that was a 6-month hospital stay, not 5 days like you have today. Why? What's going on? Good question, right?
Yes.
Why on earth are things going on? Well, I'll make the question even more pronounced. If you look at anxiety in the United States versus in Israel, who has more? Who has more anxiety?
United States.
Very interesting. We have a mixed bag.
Here.
The answer is here. You are correct. By how much? This I did share with the kids today. 75% more. The United States, the levels of anxiety in Israel, the last statistics that I saw are 25% of what they are here in the United States. Anxiety disorders. Furthermore, if you look at middle-income countries compared to high-income countries, you have half the level of anxiety. If you look at low-income countries compared to middle-income countries, you have half the level of anxiety again. 25%. Low-income countries compared to high-income countries.
You don't have to worry about money.
I like that. They're not worried about their money. Maybe. That's true. That's true, to some degree. Switzerland has, I don't know.
They don't.
One of the
It's
lowest.
not as much.
Sweden has, I think, the lowest because they're the highest on the happiness index.
Happiness. Happiness and anxiety aren't necessarily the same. What is going on in our culture in particular that is struggling so badly? I'll tell you what I think is going on. I'll give you an example of it. I think there's a general culture, and I'll give you an example of it. This past summer, there was a very interesting thing happened. I think it was a very tragic thing happened. There was a federally funded panel of physicians across the United States who recommended that all primary care physicians, every PCP in this country, screens for anxiety with every patient at every visit. You know how you screen for depression this time, right? They have the PHQ. Yeah, PHQ. Wow, I'm really tired. PHQ-3, in fact, is used because they don't use all 9 items. They ask if you're depressed, they ask if you're anhedonic, and they ask if you have suicidality. So the idea was to add the GAD-2, the Generalized Anxiety Disorder 2-item measure, to that package that all people would be assessed for anxiety. Okay, here's how that got rolled out. Those 2 items are, do you have any significant worry, and are you having any physical symptoms of anxiety over the past 2 weeks? And the items are scored on a 4-item scale. 0 means not at all. 1 is a little bit, 2 is moderate, and 3 is a lot. And the cutoff is anything more than a 0 on either item. Okay, let me ask you a question. In the last month, Who here has had no worry and no physical symptoms of anxiety? Please raise your hand. Okay? I've asked that question to 1,500 people in the last 3 weeks, and the only person who raised their hand didn't understand the question. If people answer anything more than 0 to either of those items, they are immediately screened in to potentially have an anxiety disorder and potentially given a prescription for anti-anxiety medication, usually a benzodiazepine such as Xanax or Klonopin, which are already prescribed to 92 million Americans, right, out of 350. Now, why would this panel of physicians do such a thing? Well, I challenged them on it actually on the pages of the Wall Street Journal, which was a lot of fun. And even more fun was getting a response from the American Psychiatric Association president. Yes, got their attention, nice. And I called it into question because this is at the heart of the issue. We have this culture that everything has to be perfect all the time, and that we can never feel anxious, and that anything more than a 0 on anxiety is a medical problem that warrants medication and a diagnosis and professional treatment. That is not true. That is simply wrong. People are going to have anxiety from time to time, especially during high stress situations. It's going to happen. Have you ever met anybody who has no anxiety? I know only one type of person who has no anxiety. Someone who's dead. Right. There might be a certain second class of people who have no anxiety. People who are catatonic. I'm not even sure they have no anxiety. I've seen catatonic patients, and they still have some anxiety. They get, akathisia. They get, they have the shakes and stuff like that. Some behavioral indicators of anxiety, certainly. But people who are narcissistic psychopaths. If you have no anxiety, we must speak after tonight's lecture. It's imperative that we have a conversation immediately because I'm very concerned if you have no anxiety at all. But on the other hand, I think the medical establishment in general has really embodied a general culture of worshiping the God of emotional peace. We view anxiety as a dangerous form of emotional weakness. Why doesn't everyone else feel this way? Well, guess what? Everyone else does. And the moment we, and more importantly, the moment our children start to feel anxious, this is where it really gets problematic. Because little Jimmy or little Jenny comes in and they're feeling anxious and their parents are like, oh no, what's wrong? So now what's going to happen to the level of adrenaline in little Jimmy or little Jenny? Of course, now they're alarmed because their parents are alarmed, but the fact that they're having a normal emotional response. So now we have supercharged everybody's anxiety over absolutely nothing. Do this a couple times and you end up with an anxiety epidemic. The vicious cycle that we are seeing today is that everybody here will have some sort of level of anxiety that will crop up. I'll tell you what happens to me. I get it in my chest. It's an uncomfortable feeling, and it's right here. Some people will feel it here in their muscles. Other people feel it in their stomach. Other people feel their heart going boom, boom, boom. Some people feel sweating or heat emanating. All these are functions of the adrenal glands. It's the fight or flight system. It just means that your neurons are healthy, that they're working, that something is going to happen in your body every once in a while. You get triggered, whether it's a true trigger like fear or whether it's a false trigger like anxiety. It just means that you're having a normal waxing and waning of an emotional experience. But in our society, the moment we feel that anxiety, that little bit popping up, that initial normal healthy aspect, we interpret it that something's wrong with me. Oh no, how can I, I have to do something about this. And the minute we perceive it that way, that brain signal creates more of an adrenaline flow into our bloodstream, which increases our heart rate, increases our breathing rate, increases our heat, which is generating, increases our sweating, makes us more tense. And then when that anxiety increases, then we interpret it even more that there's a problem. And that's called a cascade, where a misinterpretation of anxiety leads to, in this case, a public health problem. I think the main reason why we are having an anxiety epidemic today is we have turned anxiety into something in of itself to fear, as opposed to recognizing that you will feel uncomfortable and anxious. You know, there's some other fascinating aspects of this culture that we have. In high-income countries across the world, but really especially in the United States, we are accustomed to having a sense of control, security, protection. Everything's got to be lined up. I got my 5-year plan, my 10-year plan. I know exactly what I'm going to do. We can't stand being out of control, to the point that it even goes against some Western values. I was talking to the kids earlier on today, and I gave them the statistic. Tarot card reading. Do you know how much Americans spend trying to predict the future using tarot cards on an annual basis? Any guesses?
Too much.
It is definitely too much. 5 million? Not even close.
Probably somewhere in the billion.
It is a $1 billion industry. It is spent on tarot card reading. Witchcraft, literally.
Yeah.
It's incredible. It's incredible. We can't stand not being in control. We will do whatever we possibly can to predict the future. There's some other really fascinating statistics. Just see. Well, I'll have to leave it at that. I think that's probably enough. I want to make something very clear. I have never lost a patient to anxiety. Anxiety will not kill you. Something else will kill you. Hopefully not today. But it is not dangerous or uncomfortable to be out of control. That is part, and to not be able to predict the future. Oh, here's what I was going to say. Who here, I mean, in California, I don't know if you have to do this as much, but checking the weather, is that like a thing out here, out west? Yeah. Not as much? Like you don't really have to? Do you do it anyway?
It's not much.
Okay.
More like look outside, is it raining or not?
I guess so, yeah, and it's usually not, right?
Exactly.
It's usually not raining. So where I'm from, back out in the Northeast, checking the weather and complaining about the weather is like a big deal. And we all know, especially if you live in Boston, you cannot predict the weather. Like AccuWeather is definitely wrong. But everybody checks it multiple times a day. Like, why do we do that? Why? What's that cultural phenomenon about? And I believe that we would prefer to predict the future and be dead wrong than to admit that we have no clue what's going to happen.
Yeah.
We don't know.
Because we're scared of the unknown.
Because we are scared of the fact that we can't know and the fact that we don't know. That's terrifying. But I believe that is actually a very healthy human concern and one that can hugely enhance our lives. I speak about that in my book. All right, I want to make another thing clear, which is anxiety versus fear. Sometimes people get confused about these. Anxiety shares the same brain circuitry and physiology as fear. And fear is a very healthy adaptation. It's a healthy process that keeps us alive. It's triggered by adrenaline. And adrenaline, when it seeps into your bloodstream, it's called the fight or flight system. And that will keep you healthy if there's a threat. Now, many years ago, I was leaving my New York City office, and it was late at night. It was like later than I should have been there, probably 11 o'clock at night. I'm stepping off the curb, and I'm checking my email after a long day at work. Bad idea. So I walk off the curb, and I see a massive bus, which is flying towards me at 50 miles an hour. Apparently, someone was in a rush to get home. So I had the fight or flight system immediately it happened. I decided not to fight the bus. I decided to flee from the bus, which is probably why I'm here today. I darted out of the way. I almost tripped, and my stomach was in knots for the next 30 minutes. I was soaked in a cold sweat. I remember feeling dizzy, and that was because my pupils had dilated. The iris, they had dilated in order to expand my field of vision. And all these processes happened subconsciously in a nanosecond, and it protected me. And had I not had that fear response, I probably wouldn't be here today. Neonates, babies who do not have a fear response, usually a neurologist is called in. They have to have a Moro reflex, the startle response. That's a very healthy, positive thing. Anxiety is the exact same, but there's one tiny difference. Anyone know the difference? between anxiety and fear? Yeah.
Anxiety is about the future.
Anxiety is when there's no that's correct. Anxiety is when there's no current threat. So fear is when there is a current threat right in front of you, and anxiety, you don't have that threat yet. The threat is not necessarily there. Sometimes it manifests, sometimes it doesn't. So essentially, it's like a false alarm. But that's not a bad thing. I would prefer to have a fire alarm in my house that's a little bit too sensitive than one that will allow, God forbid, someone to sleep through a 4-alarm fire. So if you think about it, especially the current situation, we are all going to feel anxious. This does not mean that something is diseased in us. And if anything, it's a sign of neural health. If anything, it's a sign that something is going right. But we are interpreting it as something wrong. We need to reframe it, change our relationship with anxiety. And I would like to contend that once we do this, and we truly accept that we will feel very, very uncomfortable at times. Over the last week, I was counting. There were 6 or 7 times where I had palpable anxiety. Sometimes it was out of the blue, sometimes it was for a specific reason, and every single time I was able to use it in a constructive and positive way. Instead of trying to snuff it out. I think the biggest reason why we have an anxiety epidemic, we interpret it as something problematic, but more importantly, if we are seeking strategies to get rid of our anxiety, we are headed in the wrong direction. That will make it worse. As I taught the kids today, if you try to get rid of your anxiety is going to get worse. The more you try to squelch it, the more it comes back and it just with a vengeance. I'm not saying that it's fun, okay? I'm not going to tell you that anxiety is fun. It's awful. It is god awful. No one likes to feel anxious, but once we accept it, we can actually harness it in a positive, constructive way. I would like to give you 3 strategies to use anxiety to thrive in a positive way in your lives. But I must ask you, please don't misuse these strategies. If you use them and your intention is to get rid of your anxiety, they will not work. They only they only help you to thrive if you truly accept that distress is simply a part of life. You ready for the strategies? You promise not to misuse them? All right. Number 1, harness anxiety to recalibrate and to rebalance. You know what? I'm going to give you a different one. Number 1 is going to be to harness anxiety in order to build your resilience. Now, how many people here have heard of exposure therapy? All right. Okay. 20%. For those who have not heard of exposure therapy, it is a variant of cognitive behavior therapy, and it involves facing one's fears head on. It is not fun. It is very challenging, and the rewards are incredible, and the effects are unbelievable. If people, let's say, have obsessive compulsive disorder, and they're afraid of, classic example, people are afraid of germs, they have to touch things that are uncomfortable for them to touch and not wash their hands. They might even have to cross-contaminate parts of their body and not wash. It's if you have OCD in doing that and you're concerned about germs, it is very uncomfortable to do that. Let's say people are afraid of spiders. Don't worry, I didn't bring one. But I do have someone on speed dial who can bring them to my office in an hour. And he comes with a box of tarantulas. They're in separate cages, don't worry. But they do come out to play, and they're very playful. And apparently, as long as you don't pin them down and put your hand in their mouth, they won't bite you. I've never been bitten from one of these things. Let's say you're afraid of snakes. Are you afraid of spiders? We gotta talk. All right, glad I picked that example. Rather not read a tarantula. It's uncomfortable, by the way. They're fuzzy and they're kind of gross, but you gotta do what you gotta do. Let's say you're afraid of snakes. Snakes. It's the same guy who has the spiders. He also has snakes. He brings them to my office. Dogs, same thing. Heights, definitely. So I've gone skiing with patients. I've gone on chairlifts with patients. I have. Throw them off? No, I'm kidding. I'm kidding. I'm joking. Bad joke.
After or before they pay?
No.
Is that the ones who didn't pay or the ones who just did pay?
Right. You have bill to pay. Off you go. No, obviously, we never do anything that's actually dangerous. You put down the bar and then you lean over, but you do lean over. And they get so uncomfortable. And I have to do everything my patients do. So it's been, I'm a little uncomfortable in heights, but I push myself if I have patients who are doing it, and I got to do it with them. That's fine. That's part of the job. I had a patient I want to tell you about who did this. Yeah, you had a question?
Yeah, I was wondering, what about something like performance anxiety?
Yes, performance anxiety.
Somebody?
Would you like?
No, I don't know. I was just wondering.
I wouldn't get up on stage with them, but I would encourage them to give talks. Initially they would, like shyness and social anxiety, so we would have them starting by, like, let's say raising their hand in class. By the way, you do it not all at once, right? It would be like, you do it over the period of weeks. You could do it over the period of a day. The truth is you can, but it's step by step. So it could be raising their hand, speaking to people, giving a small presentation, and then eventually speaking to 100 people or something.
Like, what if it was something more skill-based? Like,
Yeah, so that's more, it's the same principles and the same concepts, but like, let's say somebody is an athlete or somebody is a musician, then we would have them do it and muster up the courage. I will tell you, with certain people performing at a certain level, they might never overcome their anxiety entirely, but that doesn't mean that they can't be extremely successful. In fact, I mean, I've seen a lot of professional athletes and people, had an NFL quarterback at one point who I was seeing, and having that level of anxiety is perfectly fine. They just know before a game they might have to hurl into a bucket, and that's fine. That just means that it's part and parcel of the process. Comedians often have very significant anxiety for this reason. They got to be on their toes. They got to know everything that's happening, right? Much more than somebody who's scripted, than a scripted actor. So yeah, it's very common, and it's not necessarily a problem. They just know that, like, if I'm performing at this level, I'm going to have anxiety, and that's all right. I just accept it as part of my job. So, sure, great questions. So this is the tool. Do something that makes you anxious. Do something that makes you uncomfortable once a week.
For example?
I don't know what makes you uncomfortable. I know what makes me uncomfortable. Yeah, there are certain things. If it could be something that you're really worried about, think about that very deeply once a week. Or I would even say once a day, but at least once a week for 5 minutes. Really worry very intently, worry deeply, embrace the possibility of something upsetting occurring, and go there in your mind. It's not comfortable, again. Do you want a story about someone who did exposure therapy? I got to tell you this story. It's a crazy, crazy story. Crazy story. I know I'm in the middle of telling you the tools, but I just got to tell you the story. I had a patient many years ago. She was a single female at the time. She had obsessive compulsive disorder that she thought she would have. She thought she had an aneurysm. She had hypochondriasis. She thought her brain was going to explode at any moment in time. She had been to neurologists. She had had MRIs. Her brain was fine. If we knew one thing about her brain, there was no aneurysm. She would not die from an aneurysm, at least not now. In therapy, I pushed her incredibly hard. She went to brain surgery units. We actually watched brain surgery together, not live, but it was really quite traumatic, but she got through it. She read stories about people with aneurysms. Her graduation, she really didn't want to die with an aneurysm and have nobody be able to identify her. So for her graduation exposure, I'm like, how do I torture her? I can't kill her. So I got to push her right up to the limit without really going over. So I came up with this amazing strategy. I was very proud of myself for this. We sent her to a different city. She went on the bus. She paid cash the entire way. She stayed overnight in a hotel, paying cash again, without her cell phone there. And she really ran the risk of having an aneurysm, dying in some hotel room anonymously, and ending up in the city morgue. Right. It was totally torture for her. This is what we do in exposure therapy, right? How do I really get this person's anxiety through the roof? That's my job. I love doing this. Anyhow, she was incredibly resilient. She did everything to the T. She conquered her anxiety, and then came the PS on the story. By the way, I didn't mention, she was really debilitated. Before she started seeing me, she wasn't able to go to the grocery store because she thought her heart rate would go higher and then she would have an aneurysm and die. So she wasn't able to move around. She certainly wasn't dating because her heart rate would go, nothing even close to that. She graduated from treatment with me, ended up dating someone, married, got pregnant, and then she called me up with a very serious problem. In utero, they detected that the baby had a very serious brain defect. So she calls me up and she's like, this is what's going on, what should I do? And she's just talking about the situation and the ultrasound and the doctors and the second opinion, and the third opinion, and which options to go to. And, immediately post delivery, she would have to have, he would have to have a surgery. Her baby would have to have a surgery. And I couldn't believe how calm she was. And I said to her, like, how are you so chilled out? And she's like, what do you mean? Like, I'm just embracing uncertainty. Like, I'm doing everything that you taught me. I'm like, well, now you're teaching me, because this is a whole new level. Like, that is just not normal. She had literally conquered it. Her baby survived, had the surgery, totally fine, healthy kid today. She's doing great. He's doing great. And she said she never would have been able to make it through that ordeal, certainly not at that level of equanimity, had she not used the strategy of doing something that makes you uncomfortable. That's only strategy number one. I'm gonna have to burn through the last ones pretty quickly because I don't wanna keep you very late. I know that our rabbi was I don't know, what time zone are you in even? Came back from Israel this morning after 3 grueling days there, so acutely sleep deprived, and thank you for staying here. Okay. The second tool is to use anxiety to enhance our emotional intimacy. Humans are social creatures, and if you look at the number one predictor of happiness and flourishing at age 80, it's the quality of relationships at age 50. Not success, not genes, not great genes, not fame, not fortune, not Hollywood, sorry. And this finding came out from the Human Study on Adult Development, one of the longest studies of what makes people thrive over the lifespan. And one of the pieces there is that if people can open up to others about their anxieties, that actually creates a sense of connection. There's another epidemic which is happening, which maybe I will write about in my next book, called the loneliness epidemic. And the loneliness epidemic is that Americans tend to be very, very lonely. However, they are not alone. Loneliness peaks during the college years in the United States, which is completely bizarre because on college campuses, you are surrounded by people 24/7. You can't go to sleep on your own. You can't eat on your own. You can't even go to the bathroom on your own. You are literally surrounded by people. So why are college students so lonely? And the answer is because typically college students, since they are surrounded by so many people, are putting on a facade. Did that just change, or is it just me?
It's the angle.
Hello. Okay. Because they are putting on, he told me I have to keep talking. If I pause, then it does that. All right. So putting on a facade of having to look good all the time as opposed to having somebody who you can be real with. Years ago, I was on a panel at Harvard College, and the head of the counseling center told me something fascinating. He presented this to the students. He said the number one predictor of students doing well is if they have at least one other person in their lives that they can speak to in a real way about emotional concerns in their life. Just one other person. And the reason why is because when we speak about what's on our minds and our hearts, that creates emotional intimacy. That's what creates a real sense of connection. That breaks through the loneliness barrier when we can actually speak about our anxiety, or in this case, our depression, our sadness, having a hard time in a real way with somebody else. Not, I'm fine, everything's fine, but I'm really struggling right now and I need this shoulder to cry on. I need somebody to give me a hug or whatever it is. Yeah.
Maybe genetics
So genetics for what?
for being nervous.
For being
For
nervous?
reaction to-
Yeah, genetic basis of anxiety is not that compelling. And the reason why is because almost everybody's anxiety has some degree of anxiety. So I love going to genetics talks because I'm never convinced by the data that I see. Usually it's genes which are combined with some sort of environment or combined with some sort of a behavior.
So epigenetics then.
Epigenetics at best. And even then, the data is not wonderful. By the way, the the reason why genetics got such, fanfare in the media is because Americans love to control things. And if we can identify the specific gene which will make us less or more anxious, great, then I can control the state. As opposed to understanding that we have a lot less control than we really think. That's the reality. Anyhow, so therefore, tool number 2 is open up to somebody at least once a week about your anxiety or about any feelings. If you're feeling distressed, it can be a therapist. It can be a romantic partner. It can be a parent. It can be a child for that matter, although there's some, pros and cons to that one. But the bottom line is open up to somebody and have a real, ideally face-to-face, not over a pixelated image of the person. Really speak to somebody in a real way about something that's on your mind. I would imagine you will become less lonely and also enhance your emotional connection. And that is using our distress to become, again, tool number 1, more resilient by facing our fears, and tool number 2, by enhancing our connection. Okay, tool number 3 is to use our anxiety in order to enhance our spirituality. Now, according to psychological science, the main reason why people feel anxious is because we can't tolerate when things are uncertain. Intolerance of uncertainty, the need to be in control and the need to know things all the time. If you get nervous on a plane, usually the reason is because, we're not in charge of where the plane is going, and it's uncomfortable to be in that situation. And this, again, is the core of the anxiety epidemic. We are really allergic to uncertainty and so bent on being in control in our society. If you look at the current crisis in Israel, it's really quite remarkable. It was not just the Hebrew word is stam. It wasn't a stam fence. It wasn't just a simple fence that the terrorists popped through. There were pressure sensors. There were specifically calibrated beams, and there was laser guiding stuff on it. It was incredible. It was one of the most sophisticated, technologically advanced borders in the entire planet. And do you know how they got across? Using a bulldozer. Very low tech. If you think a couple years ago, there was this tiny little virus, a couple nanometers, right? This doesn't even start to show how small a nanometer is, which disrupted our lives for, how long was it over here? In the Northeast, it was like 3 years. Same. What's the message? In reality, human beings are so small, and we are so vulnerable. And we're forgetting all of that by living in a first world country. By living in an area in an area of the world and in a time of history, in an epoch of history, where we think we can predict our 5-year plan, our 10-year plan. We think everything's going to be predictable and wonderful all the time. We drive on these beautifully manicured, cantilevered surfaces to whisk away water from our tires, which are perfectly calibrated in order to be able to, grab onto this much at this speed. Exactly 10 or 12 feet distance from the next car over, with lanes that are either white or yellow, depending on which way the traffic is going. Everything is, giving us a sense of control, but in reality, how much do we really control? Let's admit it. How many people in this room chose when, whether, or where to be born? It's funny, right? Isn't that a funny question? So much is out of the scope of our control. So much more than what is truly within the scope of our control. And along those lines, anxiety is a normal, healthy state when we realize there's only so much we can do. And if we're coming into the realization, the true realization of our small place in the universe, I would call that humility. I might even call that spirituality, or a form of spirituality. And that's a very healthy place for people to be, especially Westerners who are so used to having our way all the time, which is not necessarily a great thing. So these are a couple of tools which are in my book. You're very welcome to, in fact, I have 2 copies here, and I'm very happy to give them out to people who ask the best questions. How's that to making people a little bit anxious? In fact, I want to give one to the rabbi, so one of them's taken for, and the other one I will be very happy to. It's funny. You try to do something nice for a rabbi, and that's what makes her uncomfortable, right? You know that you have a great leader when that happens. So in sum, we are in many ways the most privileged generation to ever walk planet Earth, and we are also the most anxious. And those 2 things go together, because at the crux of the anxiety epidemic is our expectation to have perfect emotional equanimity, to have perfect control over things, and really this is calling for us. What anxiety is asking for us to do is to increase our resilience by actually facing our fears, to increase our connection with each other through coming together and actually being real about how we feel, and finally to give up a little bit, because there's a lot of amazing things that happen when we do. Thank you very much.
Do we have time for questions?
I'm good.
A few questions?
We do.
We do. Anybody have some questions?
Yes.
What is the difference between stress and anxiety?
Great question. Okay, stress and anxiety share similar physiology and brain circuitry, but the reason why people feel stressed is very simple, and I talk about it in chapter 1. They have too many demands and not enough resources to meet those demands. It's an imbalance between resources and demands. A very simple example is if you are 10 minutes away from an important appointment, if you are a 10-minute drive, or in LA traffic, 20-minute drive away from an important appointment, and you have to be there in 10 minutes, you will have 10 minutes of stress. If you have a bill to pay that is $1,000 and you only have $100, you will be $900 stressed, so to speak, right? It is mathematical. It really is. It's a set of balances. And stress occurs when our anxiety system, our fight or flight system is triggered because of that imbalance. And the blessing therefore, is that it calls upon us to reset and to recalibrate by making sure we either reduce our demands, which is the easier one, or increase our resources, which is typically harder, but there are ways that you can do both. That's stress. Did that answer your question?
Not really.
Oh dear. No, I'm anxious. Okay, so ask me afterwards. I might have misunderstood. Yeah.
What is the relationship between exercise and anxiety?
Yeah. Exercise is extremely helpful for anxiety. And ironically, because when you start to exercise, especially cardiovascular exercise, well, let me just qualify what I just said. I've had a number of colleagues over the last decade or so who have been doing exercise science and how it relates to mental health. And some of them have found that using exercise interventions, like I think it's 2 hours and a half a week, 150 minutes, 2.5 hours of cardiovascular exercise per week has the same effects over a 2 to 3 week span as medications, as certain medications, as for anxiety, as psychotherapy, certain psychotherapies for anxiety. So these are very powerful tools. And one of the reasons why is because when you exercise, you actually embrace, it's uncomfortable, right? You only know that you're, building muscle when you feel that burn. That's the lactic acid, which is building up, right? Or when you're doing cardiovascular activity, your heart rate is going to go higher. Your lungs are burning. It's actually uncomfortable. And that habituates us to recognizing that discomfort is actually part of life. And I think subconsciously our brains interpret that and understand it's okay to feel anxious because I'm okay embracing my discomfort. So I think, yes, there is an effect, and I think that's the reason why. Yeah.
Can you share your thoughts or some strategies around coping with anxiety related to anti-Semitism?
Yeah, I'm glad you asked. So a couple things about anti-Semitism. This is nothing new in the world. And in previous generations, it was substantially worse. even in Israel, if you count up the number of wars that have occurred, I think you probably get to about 15. 1948, 1956, 1973.
67.
Sorry, yes, 1967, 1973, 1982, and then all the intifadas, what's happening now.
2006, 2014.
A lot of operations. It's a lot of operations. Yet the anxiety is actually better there than it is here. So I think that in some ways we've had a bit of a rude awakening over the last, and listen, Harvard campus, it's not a fun place to be these days. I was speaking before with your rabbi, it's somewhere I try to avoid these days if I can, to be perfectly honest, if I don't have to go there. So I don't think we should be looking for it and, trying, but at the same time, I do think we need to look at what's happening today in its historical context. And I know people are concerned about having any outside identifying marks of being Jewish, or people are concerned about taking their mezuzot off their doors. Listen, ask your federation if that's reasonable. I can't imagine that it is. Even in LA, where I think it's worse than a lot of other places. I know there was even a death here at a rally, which is horrific, and it has not happened anywhere else in the country. So, I think everybody has to make their own decisions about what they're going to do and go through their process to do that. But I'm really trying to look at this in the historical context and understand that, it's nothing new. It's something that's sort of part of Jewish life for whatever reasons. And then it can, and in many cases does, help to build our resilience, build our sense of community, and potentially even build our spirituality, as hard as it is to accept and say that. So those are a couple of musings on the subject. Do we have time for one more?
Yeah.
Okay,
No,
good.
we've got lots of time.
Okay, good. Yeah.
Regarding the anxiety in children,
Yes.
do you think what they're experiencing is also due to expectations that are unhelpful?
Absolutely.
And also, do you feel like that high level is going to also, do you have any predictions of when it'll go down?
Okay. First, if you look at anxiety over the lifespan, it's like a clear one of these. So lower age, higher anxiety, higher age, lower anxiety. Very clear across the lifespan. If you bifurcate it, or not bifurcate it, if you divide it into 10-year segments, 60 to 70, 50 to 60, you see it's almost a linear trend to age 10 or so. It's very, very pronounced and very problematic. And I think that kids today do have very high expectations for themselves. They also have an expectation not only that they will perform well, but they will perform well easily. That they will perform well without difficulty. That's the problem. That's the problem to me. High performance, there's nothing wrong with that, but we were having a chat before, high performance is fine. You want to go for it? Great. There's gonna be an emotional toll. And I would prefer to teach kids, you want to aim for the top? Great. This is what the cost is gonna be. It's gonna be nerve-wracking, and that's fine. Let's embrace those emotions and try to help them to make us stronger, as opposed to trying to quash them, get rid of them, squelch them. So, do I think it's going to get better? I don't know. Probably not in 4. It gets a lot worse. I hate to say that.
So you don't think it's because of COVID? You think it's from this?
Well, COVID, I think it's the same thing. I think the effect of COVID was COVID accelerated it because it was a disruption that when people were struggling, we interpreted that struggle as a problem, as opposed to a normal response to a very complicated situation. I think yes, there was a lot of destigmatization of anxiety over the course of the last couple of years, and that's been positive. But the double edge of that sword is that people today expect to feel good all the time, as opposed to. I'll give you an example of this. I don't know if I'm explaining it well, but a couple weeks ago, I gave a talk in a high school, and after the talk, one of the sophomores, or maybe she was a junior, came over to me and she had tears in her eyes. And she said, we've had a lot of mental health programming over the last several years. And this was the most moving experience I've ever had in mental health. And I'm like, wow, that's really great to hear. If I'm getting, kudos from an 11th grader, like I've made it. Like that's a great professional accomplishment, fantastic. And I said, can I ask you, what about it was so powerful? She said, you are the first speaker who has ever talked to us about anxiety or mental health who has belief and faith in me that I can handle this. Everybody else has said, get rid of it, try to calm it down, something's wrong with you, do something professional, take medications, which we might have to take medications at some point, that's okay. But nobody has had faith in me.
Going back to the beginning, when you were talking about the PHQ-3, and they said, well, if they're more than 0, they wanted to put them on medications, including benzos,
right?
Which is, anxiety is a chronic condition with ups and downs,
right.
Variations. What they're proposing is making a more drug-addled society for something that can't be fixed.
I 100% agree with you.
One would wonder if the pharmaceutical companies have any influence on the individual's recommendation.
I actually don't think in this case, I've wondered that myself. I looked into it before writing my op-ed because I was wondering whether to really poke the bear. I don't think it was. I think in this case it was actually a well-intended group of physicians. Maybe I'm naive.
No.
Maybe I'm naive,
Right. I just
but
think the intentions,
I did scrape a little below the surface there, and I really think it was they were trying to do something good for society. I just think it was misguided. Yeah. Wow, lots of questions. Yeah.
I was just wondering, when you were talking about the difference between Israeli mental health and anxiety in American, so I'm a high school senior, and every time you say Harvard, my heart rate's my heart is beating so fast. But I am in the leadership of my school's Jewish club, and we had a student at the University of Pennsylvania who is an Israeli student who served in the IDF first, and then went to deepen. She spoke over Zoom, and what she was saying is that kids in Israel, when they're 17, 18, they're thinking about what division of the IDF they're going to join. They're not thinking about what they're going to do for higher education. Right. And I was wondering if you know anything more about that in terms of the plans for the future and what kind of future people envision for themselves has to do with the kind of anxiety they experience.
It's a good question. What you're saying is that the mental health situation in Israel might be different because of the cultural expectations for performance. From what I understand, writing a Bagrut in Israel is murder from a performance standpoint, and however people rank on that test will determine where they are, which part of the army they get into, including whether it's intelligence, whether it's an infantry unit, whether they're in the paratroopers. There's a whole culture of achievement around that and how people perform. I don't know if it's as competitive as Ivy League seeking Jewish students in the United States of America, which is definitely a book-worthy topic. But I will tell you this, that, firstly, it is such an idiosyncratic process for, getting into which school, when people get in. You can have the best grades, you can have the best extracurriculars, and then something just happens in the, there are so many crazy things that happen in the admissions process. It is not an objective, clear evaluation. The Bagrut actually is, because everybody's writing literally the same test. It is a standardized test, and you are compared peer to peer. It's a very socialist system. And in America, it's very individualistic, and it's much harder. So, was it this factor? Is it that factor? Honestly, it's a crapshoot. And often, getting into Harvard is the worst thing that can happen. Penn is probably better, by the way. But, I forgot this is being recorded. I'm kidding. But really, people end up where they are. There's another factor, which I just want to mention, which American students often forget. Just because people don't get into a certain college for college doesn't mean that they can't end up there for graduate school or as a faculty member. I didn't go to Harvard College. I went to York University in Toronto. It's a public university. It's like 40,000 students, right? In my Psych 101 class, I think there were 1,200 students. I was like literally I was a 9-digit number. Like I had no name for 3 years of my life when I was there. Graduate school, I didn't get in the first time around. The second time around, applied to 26 programs, got into one, my least favorite of all 26, which ended up being the absolute best fit for me. And now I've been in faculty for 14 years. So go figure. You can tell that to your friends. Yes, sir.
What
I want to get you next.
What effect has
Sorry.
drug advertising had
drug
on the American public? Because we're one of only 2 countries in the world that allow you to advertise drugs.
It's a great question. I think it's sort of seeped into the psyche that, you know who's spoken about this? It's an amazing book, Anatomy of an Epidemic. It's a very controversial book in psychiatry. And just speaks about the proliferation of drugs and these, medication. The idea that you can control your emotions using a pill is such an alluring idea. Like I can actually change the way I think, the way I feel. I can optimize that. I can reduce my distress. I can boost my mood. I can boost my performance by taking a pill, by taking a substance. There's an allure to that idea. And I think advertising has played into that allure. And there's even some validity to it, because there are pharmacological agents that would have very important place to do. Like, more than 50% of my patients are using pharmacology. I'm sort of just spitballing here, but I can't imagine it doesn't have a massive effect. I do think that we have tipped over into some dangerous territory when it comes to this culture, and that the anxiety epidemic that we're facing is largely a result of this. So, yeah, I do think it's a big factor. I promised you I'd ask. Yeah, I knew you would ask.
Me?
Yeah.
Okay. Question, I know you talked about how anxiety rates are much higher than they were decades ago. Do you think there's any causation between economic factors in that? Like, I feel like my anxiety is justified compared to like my parents, because they own a home and I never will. So.
In LA?
They live elsewhere, but
Got it.
Just in general, I mean, everything's gotten so much more. So I feel like, people my age, like, of course, we're more anxious because college costs more, healthcare costs more. None of us can afford a home. That wasn't true for previous generations.
So I don't know your parents' circumstance. I don't know. I do.
I just said it as an example. They're fine, but yeah, they own a home. Those jerks.
Okay.
I'm just saying in general,
I'm not sure that economically things are worse off today than they were 50 years ago. My sense is that after the Great Depression, things were pretty bad. World War II was in some ways good for the economy, but afterwards there were some, there have always been ups and downs in the economic cycle. I mean, the 80s were really great, the 90s were not so great. And I know a lot of people who lost their shirts during that period. Yeah, I think it's sort of a little bit more nuanced, that there have been struggles that every generation has had. I think that the struggle that younger folks are having in the United States is more...
You're going to blame me for buying avocado toast. Don't go there.
I'm not.
Just saying.
I'm not, but I actually do think there is some more there are economic opportunities today that people can and do have that go up and down in accordance with economic cycles. I'm not sure much has fundamentally changed from an economic standpoint.
I mean, like, my college costs 100 times more than like it did for my parents, and wages haven't gone up like at all. So I mean, there is truly an increased cost of living that, sorry, older people, if nobody wants to admit that, but things cost more for.
The middle class is shrinking.
Yeah.
I hear that.
disparity of wealth. Yeah.
Yeah.
I have to give
I'm not lucky enough to have a trust fund, so.
Got it. I want to give it a little more thought. It's a good question,
Okay.
and I want to give a little more thought. All right. I'm going to get back to you. But yeah.
Going back to what this gentleman
Yes.
was saying about pharmaceuticals, and what is your take on meditation
Yes. Great. Meditation.
and mind and body connection?
Yes, absolutely.
Stay away from all that.
Okay, meditation. It depends on how it's used. Meditation's become very popular in order to deal with anxiety. And if we use meditation in order to get rid of our anxiety, like let it go, put it on a leaf, send it down the river, that kind of thing, usually it makes it worse. In fact, learning how to breathe if people are using their sort of breathing intentionally in order to deal with anxiety, that actually tends to increase people's levels of anxiety over time. However, if people are meditating in order to attend to the anxiety in a mindful way, mindfulness is, wow, the anxiety is in my chest. Oh, I didn't notice that. It's also a little bit in my stomach. I'm being mindful, not mindless. I'm attending to it and thinking about it. You actually, in the moment, feel more anxious. So if meditation is used in a mindful way in order to actually magnify the symptoms in the moment, it can indeed build resilience, build connection, build our humility, and move us in the right direction. But if we misuse it, it's a tool that if you use it in the right way, it can be very helpful, but if not, it can be problematic.
Quick question.
Yeah.
What is your take about laughing meditation?
I don't know about laughing meditation, so you're gonna have to educate me.
We can all start laughing together and see how we feel about anxiety.
Probably be pretty helpful. That'd be probably really helpful. Yeah, you in the back, sorry.
So back to what we were saying over here. I know that if my chest and whatever starts up first thing in the morning or whatever, I've also learned that if I do deep breathing, it takes it all away because it opens up my chest from constricting and I feel better.
If it's working for you, don't change it. For sure, don't change it if it's working. Now, why is that the case? I can think of a couple reasons. Off the cuff, not even knowing your name, the anxiety is because of stress, because of an imbalance of demands and resources. Like you mentioned, because it happens first thing in the morning and it's in your chest. So those are two indicators that it might be stress. If you're taking a couple minutes to deep breathe, what you're really doing is boosting your resources, and you're also decreasing your demands because you're not running into your day. You're recalibrating and rebalancing, which is actually an active self-connection that your anxiety is leading you to do. So that could be an explanation for how it works. But I don't know. I'm literally
I'm sure it's all part of that because I've been through therapy for so many years.
Okay.
That it's learning what is your trigger.
Okay.
We have about 2 more questions.
2 more questions. That's tough. We've got 4 hands up. Did you go for it?
I was wondering if you have, as much as I don't like to ask for solutions, but in my case, the anxiety really appears before I get up. And that seems to be the very strong experience.
Before you get up in the morning?
Yeah. Like
when you're
in
asleep?
bed.
When you're in bed?
Yeah.
First thing in the morning?
Yeah. And it's like as soon as I get up, then it all disappears. And I'm just like, I don't know if it's the sunshine or the shower or whatever, but that in bed things are so different versus out of bed.
Okay. People have anxiety during any points in the day. Why aren't we just assuming this is just how you're built and you have a little bit of anxiety in the morning and we'll get out of bed and move on? That's kind of it. You want to use it in a positive, more constructive way. I have a couple of questions. You can ask me afterwards.
Okay.
But I have a couple of questions for you. Okay. Does that one count? Yeah.
One more.
Okay, yeah. Yeah, sure.
So this is a bit of a technical one, and this one's a little almost, so I'm actually studying to be a psychotherapist.
Oh, good.
And I was in my process class yesterday, and I was in the role of therapist, and one of my colleagues was his client, and he's, everything you've been describing, right? the anxiety, using meditation in all the wrong ways, and I've been seeing it, like this was our third time doing it in that coordination, and I'm like, he's now gotten a lot worse. Like, in fact, it was so bad that I spoke to the professor about it this morning because I'm worried about him. In the moment, like I was struggling for like, what can I say to him that would, help him not look like he's looking outside for something to relieve this emotional suffering, which is all this anxiety. And I had already figured out where it was coming from. But he didn't want to talk about that. Where do you, when you have someone who presents with everything you're saying, like they're using their anxiety, they're trying to get rid of it, they hate it, like, you do the empty chair and like they're screaming at their anxiety, right? What do you do?
How do you help a patient who doesn't want to be helped? You can't.
Yeah.
There's nothing you can do. Help be the change you wish to see in the world. That's it.
So there's nothing I could have.
Well, nothing you can do right now. You can wait. You can always patiently wait for somebody. But if someone's not ready to change, it ain't going to happen. Well, you said you're just starting to be a psychotherapist, right? Great. If you learn that now, you're way ahead of your peers.
I think there was one more question.
Okay. Bring it home.
Okay. I don't know if this is really a whole separate category, but I was wondering if you could say anything about anxiety and PTSD.
Sure.
Because you've got PTSD.
Post-traumatic stress disorder.
Triggering that's going and going and going.
Yeah. So firstly, about PTSD, we only diagnose or deal with PTSD 30 days afterwards. So and that ends at the end of the afterwards, at the end of the situation. So the current situation going on in Israel, especially for people who live there and are dealing with it, and it's actually trauma, that's not post-traumatic stress disorder. That's like an acute stress situation. So I just want to differentiate between those two. What's very interesting about PTSD is that the number of people who experience a traumatic event versus the number of people who end up having flashbacks and all the physiological symptoms and other emotional sequelae, which are commonly associated with PTSD, is actually 10 to 1. Only 10% of people who have a traumatic event end up developing actual PTSD. And that really speaks to what do the other 9 out of 10 people do with those experiences? One of the key pieces is community. If you have somebody you can speak to, who you can grieve with, who you can connect with in the wake of a trauma, that makes all the difference. And it's one of the key factors in whether people end up developing PTSD. Also, even if you have that connection, that community, but you can't speak about the trauma, right? One of the worst pieces of advice that was given to the veterans coming back from Afghanistan was don't speak to anybody about what's going on, right? It really created rifts between them and their families, and then there was alcohol use and family discord, and PTSD went through the roof, and now the rates of disability are very high. As opposed to share limited information and share your feelings about it, that would have been a much better public health move. So a couple of musings about that subject. We're good? Thank you very much.
I guess you're here if you invited in consultations. But thank you all for being here, and we look forward to welcoming you again for additional events. Thank you.
That the mirror image of pseudoephedrine, like the nasal decongestant, is meth. So it's something like that, where it's in the case of adrenaline, they have the same like chemical properties but on different levels, and so I guess like people are doing more studies. But like there's a lot of enantiomers where there really is no difference, and it seems to me based on like the 2 articles that I read while you were speaking that it was kind of bogus. But I was just wondering if you had a history in chemistry, if you had read.
I wish I was holding that kind of stuff. There's probably people in my department who are doing that kind of work, but So I can do, if you pin me, I can look into it.
Okay, well, I applied early. I applied early to Harvard. I'm a senior, and on December 15th I find out if I get into Harvard. So if I end up there, maybe I'll be stopping by the department. Maybe I will go into STEM. Who knows?
Into where?
Into STEM. I have like no intention of going into STEM. I'm like much more.
And every time she takes a science class, she ends up liking it.
Yeah, like I loved physics, and I really like organic.
Do what you love. Do what you're good at.
Well, I'm better at languages. I really like it.